Syphilis. Syphilis is a disease caused by the bacterium Treponema pallidum, which is transmitted sexually during vaginal, anal or oral sex or vertically from mother to fetus via placenta, or by penetration through intact mucosa or abraded skin. It can cause serious complications when left untreated, but it is simple to cure with penicillin G intravenously for 2 weeks. How is syphilis spread? Syphilis can spread by direct contact with a syphilis sore during vaginal, anal, or oral sex, and can find sores on or around the penis, vagina, or anus, or in the rectum, on the lips, or in the mouth. Syphilis can spread from an infected mother to her unborn baby via placenta. Syphilis is divided into stages: primary, secondary, latent, and tertiary. There are different signs and symptoms associated with each stage. A person with primary syphilis generally has a sore, or sores at the original site of infection. These sores usually occur on or around the genitals, around the anus, or in the rectum, or in or around the mouth. These sores are usually, but not always, firm, round, and painless, and they are called as chancre. Symptoms of secondary syphilis include red or brown rash on skin soles and palms, swollen lymph nodes, sore throat, fever, headache, arthralgia, splenomegaly, and rash disappears spontaneously. The signs and symptoms of primary and secondary syphilis can be mild, and they might not be noticed. During the latent stage, there are no signs or symptoms. Tertiary syphilis is associated with severe medical problems. It can affect the heart, brain, and other organs of the body. This is a slowly progressive destructive disease. Neurosyphilis can occur at any stage of the disease, and may occur in the absence of central nervous system symptoms too. When central nervous system symptoms occur, they range from cognitive derangements to motor derangements, and may be associated with eye infections like posterior uveitis, panuveitis or neuroretinitis. Diagnosis of neurosyphilis can be done by CNS examination and CSF examination. Congenital syphilis, treponema, can readily pass across the placenta and can cause miscarriages, stillbirths and premature births. When the born baby may develop bone deformity, anemia, hepatosplenomegaly, jaundice, rashes and central nervous system symptoms, or may be asymptomatic at birth. Maternal testing during pregnancy and testing of newborn is needed for early diagnosis and treatment. Diagnosis of syphilis. Bacterium is fastidious and sensitive, therefore cannot survive long outside of the host, therefore it is not cultivatable, and lesions are transient, hence traditional diagnosis is difficult. Direct microscopy can be done in primary and secondary lesions, and a clinical diagnosis followed by serological confirmation is done commonly. Non-specific antibody test, venereal disease research laboratory test or VDRL test, now mostly replaced by rapid plasma reagin, presence of Ig or Im against cardiolipin antigen, gives a positive result. This is used as screening test. 70% of primary and 99% of secondary syphilis patients would be positive and negative and latent and tertiary syphilis. Increasing titers suggests congenital syphilis and positive tests suggest active infection. This can use to monitor treatment response. CSF test for VDRL is done to diagnose neurosyphilis. Specific antibody detection tests, there are 2 tests. 1. Fluorescent troponemal antibody absorption test, serum is used as sample, and we are looking for antibodies. Treponema pallidum is used as the antigen in the test, and bound antigens are detected by fluorescein-labeled conjugate using a UV microscope. Serum is adsorbed with a non-pathogenic treponema to prevent cross-reactive antibodies being detected. Using this test, primary, secondary and late syphilis can be detected. This antibody reaction remains positive for life, therefore can't use to monitor treatment. 2. Treponema pallidum hemagglutination assay. This is also a specific antibody detection test, and blood is used as the sample, and we are looking for antibodies. Treponema pallidum antigens are coated on red cell surfaces, and it can be detected with the agglutination after the reaction with positive sera. This test has a lesser positivity for primary syphilis than fluorescent troponemal antibody absorption test, and remains positive for lifetime. can be used for local antibody detection in CSF in detecting neurosyphilis.